Right. The next bill on the agenda is House File 1355. It is my bill, but it's also a public safety. Commissioner Schnell will be presenting it and his staff, and so I'm just going to keep the gavel in the sake of interest and time. So I will move that House File 1355 be recommended to be placed on the general register. I do have an author's amendment, the A3 amendment, and that amendment, I will move the amendment. It clarifies some language that was inadvertently left out in the original draft. It clarifies the arrest warrant authority we're requesting in the bill. It adds Colton's law back in that was inadvertently removed, and it includes language clarifying the statute on conditional medical release for future pandemics. Is there any discussion to the A3 amendment? Seeing none, all those in favor signify by saying aye. Aye. Opposed, the motion prevails and the A3 amendment is adopted. And then I have one other amendment, members. It's the A2 amendment. And this was a separate policy bill from the Department of Corrections. We wanted to just combine this so that we had one policy bill. It's House File 1483. And it provides that community supervising agents are added to the list of those eligible for line of duty death benefits. Any discussion to the A2? Seeing none, all those in favor signify by saying aye. Aye. Opposed, the motion prevails and the A2 amendment is adopted. All right, and with that, the bill as amended is before us. Commissioner Schnell, would you like to describe the bill? And if we can do it it's a lot, but let's go for it. And please introduce yourself again.
Yes, Madam Chair, thank you. Paul Schnell, Commissioner of Corrections, and I will go through this quickly. Really much of this is a combination of several technical and clarifying modernizing changes to statutes governing the DOC's work, and I'll just walk through them. First, the bill creates the statutory requirement that the department have a language access plan. We want to thank Vice Chair Feist for carrying this bill last year. Currently, there is no requirement for the DOC to have a language access plan in place for its facilities and for individuals under its supervision who have limited English proficiency. And we have been working toward implementing this policy, but we do believe that this should be built into statute as we go forward. A second component, this bill also repeals an unused statute focused on community intensive supervised release program. This is a distinct statute from intensive supervised release, which continues today. This is a law that statute that has not been operational since 1995, oftentimes confused with intensive supervised release. And one of the goals of this antiquated program was to punish the offender, which is not in alignment with the mission of us or our supervision partners across the state, which has been really more focused on rehabilitation and community engagement. In addition, the model was used as a justification for how ISR operates, which was mainly focused on surveillance, which led to poor outcomes instead of using evidence-based intervention practices. As important to note, the amendment that you all just passed ensures that the portion of the law known as Colton's Law is maintained. It was not our intention to do that. It was a mistake as we were doing some drafting. Colton Law, just so people know, requires electronic monitoring device to be placed on people under phase 1 of intensive supervised release, or ISR, before they are released from custody, so that they actually leave the facility with that electronic monitoring capability in place. The next provision in the bill is an automatic mechanism to shift funding when a county requests that its supervision delivery system change. Currently, when a county chooses, and I want to emphasize it's a county choice, to have the DOC provide supervision services, the statutory structure does not allow for those appropriated funds to come to the DOC, who would now be providing those services. Instead, it has to go to the general fund, and we need to make a separate request. These dollars were already appropriated for community supervision in that particular county. And when that county makes the switch, we are simply asking that those funds remain in the community supervision bucket, and just the agency is allowed to use that to cover the cost of providing supervision in that county. The next one updates updates substance use disorder treatment standards of care, and these align directly with the community standards and the Department of Human Services waiver. It directs and provides incarcerated individuals to complete SUD treatment without consideration of the SUD recommendations that are necessary in order to place people in the appropriate treatment settings, reflects best practices, and allows for easier access to care upon release. It modernizes the statute and brings us in line with best practices. The next provision really simply allows the Department of Corrections to electronically file disposition of detainer paperwork to the court and the prosecutor. Current statute requires the use of certified mail. This bill modernizes the process and allows us to use systems that exist. The next bill provides the DOC with the authority to issue a warrant when an individual who has been given a report date to prison does not comply with that. Under current authority, we do not have that access because they are not in DOC custody, which is one of the requirements under the law. So they fall in this provision of a warrant for commitment has been issued with a future date, which we do not have them in our custody. And so they still remain in this quandary. Are they under court's jurisdiction, or are they under DOC jurisdiction? This bill really allows us to issue a warrant to get that person into custody in the rare occasions when an individual fails to report. The next provision allows the operation of a challenged incarceration program at the state's only women's facility. The current statute allows those to operate only at Togo and Moose Lake. However, for the past 6 years, we've been providing challenged incarceration or boot camp programming at Shakopee in order to make sure that women have access to that program as well. But the statute does not specifically name Shakopee, and what this does effectively just brings the statute in alignment to make sure that there is equal access to these programs across the state. The next one just clarifies membership on the Advisory Council for Interstate Commission for Adult Offender Supervision and the Interstate Commission for Juveniles. Both of these interstate compacts that we are involved in, and Chair Mueller had carried this bill, passed off the House floor previously, but it brings both the adult and juvenile interstate compact into alignment. And however, current statutory language for both bodies is vague and in regard to who specifically must serve on that councils. And this modernizes and brings us into compliance with all federal requirements that are mandated. And we've already talked about the issues related to the amendments. I would just point out that there is the ability here for us to move place juveniles who may be certified as an adult and normally would go to this kind of awkward space of a youthful offender programming, would allow us, when that is deemed appropriate, to take that person who is under age 18 and allow them to be placed in youth-specific program at Red Wing during that portion of time. And I think, as mentioned, the state bringing into line state death benefits, this really allows for, and God forbid it ever happens, but it would allow for people who are providing supervision across our state to be included in the state's line of duty death benefits, and other non-uniform staff working in the prisons, a teacher, a nurse, others who could be subjected to that situation. We want to make sure that that there is the ability for them to access this benefit as they are providing a direct service to people who are in the state's care, custody, and control. Madam Chair, I believe that covers the issues in the bill. If there's anything else I can clarify, I stand for questions.
Yeah, thank you, Commissioner. And I'll just note, too, that a big chunk of this bill is just showing what the interstate compact is. So I carried that bill last year, like you said, and really the changes to the compact are very minor, but because we're making changes to the compact, we have to include the whole compact in the language. So it makes it look like something a lot more extensive than it is. I do have a question. So can you speak to, it's my understanding that MMB said that there would not be a fiscal note on this. Could you speak to that, please?
Madam Chair, yes, we have consulted. These are really things that either are happening now or the slight variations that we have already built into our operations. And so there is no fiscal note for the implementation. These really provide a broad range of I think, policy direction and modernization from the legislature to the department.
Thank you. And before we move to member discussion, I should ask, are there any public members who wish to testify? All right, I'm not seeing any. And we do have an A1 amendment. Representative Tabke, would you like to move and explain your amendment, please?
Thank you, Chair Moeller. I will move the A1 amendment. And what this is Shakopee Prison is in correctional facility is in my community, in my district, and I've gotten a significant number of letters and information from those incarcerated there. And the challenge program that we just talked about, Commissioner Schnell just talked about, is a really great program, and it has basically right now, if you get removed from the program for any reason, you cannot get back in. And what the amendment does is allows for folks who who have been removed from the program access to the program again to get back into challenge. And it has been, I've talked to employees at the Shakopee Correctional Facility and Department of Corrections, and so everyone has agreed that it's a really good thing to move forward with.
Thank you. Any discussion to the A1 amendment? Representative Feist.
Thank you, Madam Chair. I just wanted to mention that I also received a lot of letters about this, and I think it's a really great idea, and I'm so glad that you brought this amendment.
Any further discussion? Seeing none, all those in favor signify by saying aye. Aye. Opposed? The motion prevails. The A1 amendment is adopted. And now we can move on to member discussion of the bill as amended. All right. Not seeing anything. I would normally have closing comments, but I don't. Thank you so much, Commissioner, for walking us through that quickly, but we really appreciate it. And with that, I ask for your support, and I will renew my motion. I'm going to make sure I get this right. That House File 1355 as amended be recommended to be placed on the general register. All those in favor signify by saying aye. Aye. Opposed? The motion prevails and the motion prevails. I went back to amendments again because we had so many. Thank you, everyone.